Hey everyone, thank you so much for joining. We are going to get started in about 2 minutes. All right, I think we are good to get started. My name is Tamalyn Wandler. Thank you so much for joining today's webinar. This is our quarterly compliance webinar. Just a little bit of background. I am Innovative's Director of Compliance, for those who don't already know. So before we begin, I wanted to give a bit of information around who Innovative is. So for those that don't know, Innovative is part of a larger organization called United Benefit Advisors. UBA allows us to remain independent, but does provide us with aggregate purchasing power, knowledge, and resources of around 150 firms joined across the United States. We like to think we are the best of both worlds. We are not local or regional firm. We are an independent firm that has all the same access and resources as the national players do. So with that, I will jump right into the agenda. Quick housekeeping things. Everybody is muted, but if you do have any questions, you feel free to add them to the chat or the Q&A, and we will discuss everything at the end of the presentation. So for today, we're going to spend a little bit of time on the One Big Beautiful Bill, as well as some other legislative updates, some on the horizon things, and then round it out with the Q&A. So with that, we'll jump right into the One Big Beautiful Bill. So after much debate, Congress did pass the One Big Beautiful Bill Act, or the BBBA, which, among other things, incorporates expansive changes as it relates to tax, health, and employee benefits laws. Specifically, I will touch on the following items. So the HSA expansion for telehealth, there are some changes to direct primary care arrangements. There's some changes to coverage under bronze and catastrophic plans through the marketplace, as well as some dependent care FSA changes. The first item that I wanted to talk about is the HSA expansion for telehealth. So the act included permanent expansion for pre-deductible telehealth services for those with high deductible health plans. This is effective for plan years beginning after December 31st, 2024. So not sure if you remember, but the CARES Act, which was enacted during the height of the COVID pandemic, CAA 2022, and then again in CAA 2023, previously extended these flexibilities and allowed for folks who were enrolled in a high deductible health plan with an HSA to receive telehealth services prior to reaching the deductible. As a reminder, that typically is not allowed. So those expansions did sunset, with the most recent expansion sunsetting as of December 31st of 2024. So plan years beginning on or after 1/1 no longer could do this. This expansion now says that it's permanent. If you do have a high deductible health plan with an HSA, this type of coverage is available pre-deductible. And it is effective for plan years beginning after December 31st. So even though we are now in July, those plan years, it's still okay. It reverts back to that 1/1 date. So definitely something that was being pushed for on the federal level, the state level. A lot of advocacy groups were really advocating for this expansion to be permanent. So this is one of the big things that really came out of this law. Another change is related to direct primary care arrangements, or DPCs. So under the Act, DPCs will not disqualify an individual from contributing to an HSA so long as the DPC fees do not exceed $150 per month for an individual or $300 per month for families. The fees will also be recognized as qualified medical expenses that can be paid tax-free via the HSA. So prior to this, that was not the case. This type of coverage did disqualify HSA contributions. The second item is related to bronze or catastrophic plans through the individual marketplace. So the Act allows for these plans to also be HSA eligible. So as we can see, there are a number of HSA provisions in this bill. So it really does kind of emphasize the fact that at the federal level, there's a lot of focus on folks who have an HSA being able to continue contributing to the HSA. There were other HSA provisions that were initially part of the bill that via the negotiations eventually were scrapped. So it doesn't necessarily mean that we won't see those things in the future. It just means that they aren't included in this specific spending bill. So it's entirely possible that some of those changes may come through in different acts or bills in front of Congress. And then the last item I wanted to discuss is related to the contribution limit increase for dependent care FSAs. So under the Act, participants will now be able to contribute up to $7,500 to their dependent care FSA. Previously, this contribution limit was capped at $5,000 and has been capped at $5,000 since 1986. So we did see some changes, a temporary limit increase during COVID. It was increased to $10,000, but that was quickly dropped back to $5,000. And one of the things that I really want to kind of hammer home here is employers who have a DCFSA or implementing this change really need to be mindful of how this is going to impact their non-discrimination testing under IRC Section 129. So this section is one of the most commonly failed non-discrimination testing sections. And which, if it fails, it's not the end of the world. Really, it just means that corrections need to be implemented prior to the end of the year. It's, like I said, it's very common. A number of employers have to do this. So it's not a huge deal, but it is something to keep in mind if you were to consider putting maybe a prospective cap in place for highly compensated employees to try to mitigate the risk of the failure. Alternatively, you can just implement it with no cap and see if you fail when you do the annual testing. But did just want to note this. We have been thinking about this and trying to develop the best approach for our clients. So wanted to mention as well. With that, I'll jump into some Consolidated Appropriations Act 2021 items. This is something that I have spent significant time on in past quarterly updates. If you've joined any of our lunch and learns, I always eventually mention this. So not going to spend too much time on the provisions themselves. We'll just at a high level mention a few things here, and then we'll discuss some other more pressing items related to this. So there are four main pillars, if you will, of the CAA that impact plan sponsors and plan fiduciaries. The first being the broker and consultant compensation disclosure, which requires brokers and consultants to provide a disclosure of the direct and indirect compensation they receive. The second is the gag clause prohibition compliance attestation, which requires plans and issuers to ensure gag clauses have been removed from their contracts and requires the plan sponsor to attest to this annually. The third item is the RxDC reporting, which requires plans and insurers to submit several data files to CMS on an annual basis. And then the fourth item is the NQTL analysis, which requires plans to ensure their compliance with the Mental Health Parity and Addiction Equity Act as it relates to the non-quantitative treatment limitations under their plan. So the main thing that I really wanted to touch on here is related to the NQTL analysis, specifically the final rule. So the departments have paused the enforcement of the 2024 final rule, which established additional obligations for the plan sponsors. Uh, what I will say is that despite this pause, the obligations under the CAA related to the NQTL analysis still exist. It's really just the provisions of the final rule that are paused. And this is significant because it does lessen the burden of the additional obligations for plan sponsors. Specifically, the final rule added additional regulations addressing the content of the comparative analysis. It required plans that were covering these benefits to provide meaningful mental health and substance use disorder benefits in every classification in which the plan covers medical and surgical benefits. It also required the collection and evaluation of data assessing the impact of the NQTLs on access related to outcomes. And then it also added numerous clarifying examples and definitions for broad fundamental terms under MAPIA. And if that's not all, perhaps one of the more welcome news that we get as a result of this pause is that plan sponsors and ERISA plans are no longer required to have a named fiduciary certified that they have engaged in a prudent process to select qualified service providers to perform and document the comparative analysis and satisfy their fiduciary duty to monitor the service providers in performance and documentation. So that really was one of the big changes that came out of the final rule. It was something that we definitely fielded a number of questions on around what does this actually mean? We were waiting for some additional guidance related to that, and then they ended up pausing the enforcement. So we are still kind of waiting on guidance here, but for now, that provision no longer is enforceable. With that said, as I mentioned, the rules outlined under the CAA 2021 are still in effect. So plan sponsors are still required to conduct the analysis and should continue doing so or start if they haven't already. Despite this fiduciary certification requirement being paused, I would still advise plan fiduciaries to document their processes as it relates to the analysis and continue engaging with qualified providers in the event that the pause is lifted and the requirements are reinstated. And then wanted to give a couple additional employer considerations, as this is something that we continue to work with our clients on and really kind of hammer home the importance of being mindful of your fiduciary duties as the plan sponsor. So under ERISA, employers are considered fiduciaries in their role as health plan sponsors and administrators. Certain other individuals, like a person, a committee, an entity, or service provider, may also be named as the fiduciaries in the related plan documents. So at least one fiduciary must be named. I'm sure if you were to pull out any of your plan documents or if you have a wrap plan, that individual or entity will likely be listed in the plan document. If it isn't, you will want to update that document to make sure everything is there. On this slide, I do have a few employer considerations when considering your obligations as a fiduciary. One of the most important steps for the fiduciary to take is to first establish a fiduciary committee for the health and welfare benefits, and then to delegate responsibilities to each member of the committee. Fiduciaries should review their agreements with their carriers and document their policies, procedures, and decisions related to vendor selection and performance monitoring. As I said, you want to make sure you have this fiduciary committee in place. Want to make sure that you have a charter. Make sure folks know about the charter and what their obligations are. Need to be collecting meeting minutes when you meet with the committee. And you may also want to consider having some kind of fiduciary insurance in place for your medical plans. Typically, we see this more on the retirement side. And as you can tell with some of the other CAA provisions, a lot of these things mirror the retirement side. Retirement benefits, retirement plans, those disclosures are something that we've seen on the retirement side for years. So really want to make sure that your ducks are in a row with your health benefits. As we've seen from some litigation, from documents and bills and everything that we're getting from the federal government, it indicates that there is a focus on compliance with these things. So you want to make sure that all your ducks are in a row. If you go to our website, we do have some template documents. We're also working with our clients to help them with these processes and kind of assist them with establishing these committees. That'll jump into a few legislative updates. I do have a number of slides here, so I will try not to rush through them, but wanted to give you some high-level updates. So the first one is related to the HIPAA reproductive health privacy rule. So the final rule that was finalized last year and was effective as of the beginning of this year uh, has been paused. It was deemed unlawful by a district court in Texas, and therefore it was vacated, and then there was kind of a hold on enforcement on that. So what that final rule said was that data related to reproductive health could not be easily disclosed. There were requirements around implementing new policies and trainings. There was requirements for business associate agreements to be updated. There was also an attestation requirement, which basically said that the individual requesting the data had to attest that they weren't going to use the data for certain purposes. So that rule specifically is paused. There's no indication whether or not they will unpause it. I mean, it's possible that HHS might come out with a revised version. So more to come on that. But one thing to note is that the court only vacated the provisions that it deemed unlawful. So the remaining modifications to the notice of privacy practice that are required to go in place by February 2026. So there are some updates that still need to be made to your notice of privacy practices. Those still stand. They aren't necessarily related to reproductive health. So I just want to make sure that you're keeping this in mind as you start to go towards maybe your open enrollments, you're starting to put together those notices. Just want to make sure that the notices are updated for the other final rules, but not necessarily for this specific item. You don't really need to worry about it too much right now. But again, more to come. As we get more updates on this, we will release blogs and e-blasts. Same thing with really any of these items that if I end it with more to come, you can pretty much guarantee that we are going to release something on it. So you make sure that you're subscribed to our various social media accounts, because we typically do post things there and post links to our blogs. The next item here is related to the EEOC's abortion accommodation rule. So under the Pregnant Worker Fairness Act, it required employers to reasonably accommodate employees experiencing limitations stemming from pregnancy, childbirth, or related conditions, unless doing so would impose an undue burden. So the EEOC, after this was established, after this act was enacted, the EEOC had a interpretation that this included, specifically that related conditions item, included time off or time needed for some kind of abortion service. In Louisiana, a few months ago, a court said that's not the case. The EEOC has exceeded its authority, and therefore this rule, this specific provision is blocked. So it just means that employers are no longer obligated to offer accommodations like time off or other work adjustments. In this case, there are other lawsuits pending on the issue, so there is more to come. However, the interesting thing about this specific ruling is that it does apply nationwide, whereas there are some other cases that we see that only apply in that specific district. In this case, it is applicable nationwide. The next item is the New Jersey Pay and Benefit Transparency Act. I want to spend a little bit of time here. So this was effective June 1st, 2025. And what it says is that employers in New Jersey, or employing folks in New Jersey with 10 or more employees over 20 or more calendar weeks must comply with this law. So that's the vast majority, I would say, of employers within the state. And the current employers include those doing business, employing individuals, taking applications for employment. So it really is very expansive. And what it says is that employers are required to disclose the hourly wage or salary for advertised positions and a general description of benefits and other compensation programs the applicant is eligible for within the first year of their employment. So employers that are advertising for a position that may be considered a promotion for an existing employee. So this is an important addition or an important caveat. They must make reasonable efforts to inform all current employees within the impacted department of the promotion opportunity prior to determining who they will select for the position. One other thing I want to note is that covered employers that fail to comply may face civil penalties of $300 for the first violation and $600 for each subsequent violation. Doesn't seem like a lot, but these are, separate penalties, separate violations. So if you just do, if you run into an issue one time and that's your first violation, if you run into the issue a second time, that's again your first violation for the second time. So just something to keep in mind. But with anything that has some kind of civil penalty attached to it, really want to be conscientious. And there is more information on this act and what complying may look like on New Jersey's Department of Labor website. But of course, if you have any questions, I'm happy to assist you with it. And a few employer considerations here. So things you really want to be mindful of. Of course, you want to update your job descriptions and pay ranges if you have public postings right now. The thing with the pay range is that you can't have something that says up to $30 an hour, for example. You need to have between $25 and $30 an hour. It has to be more specific. You want to make sure you're updating those descriptions, make sure that you're updating the processes and procedures, and then training folks that are in this department in recruiting that handle the job postings, just to make sure that everybody is aware of what they need to do. Then potentially consider conducting a pay equity and HR practice audit. It's always good to really know where you stand with these policies, with your procedures, just in case there is an issue in the future, you can really mitigate your risk that way. And then obviously, like with everything, you want to continue to monitor legislative updates in case things change. What I will say about that law is that it joins a number of other states that are already doing something similar. So really something to keep in mind if you have employees or you're hiring employees in multiple states. The next item is related to the Affordable Care Act, specifically the penalties that are assessed through a 226J letter. So a federal district court in the Northern District of Texas held that under the ACA, the certification process that's used to determine the penalties must be administered by HHS, not the IRS. So the reason this is relevant, so to speak, is that those 226J letters, if you've ever received them or you've ever seen them, they come from the IRS. So what this is saying, what the court is saying, is that the IRS is exceeding their authority. They aren't the ones that should be assessing these penalties. It's actually HHS that should be. And for better or worse, HHS does not currently have a certification process in place. So it can be argued that the IRS is unable to impose penalties altogether because there is no certification process that they can rely on through HHS in order to assess these penalties. With that said, this decision is only binding in the Northern District of Texas, so a very specific place. Now, that isn't to say that it's not something to be mindful of. The IRS and HHS could decide to change their procedure to conform with the ruling, or they could decide to maintain their longstanding position and wait to see if other cases are brought and how those courts rule. So since the decision is only effective in the Northern District of Texas, it really is unclear what will come of this on a national scale, but still something to keep in mind. It doesn't really mean that previously paid penalties, maybe say 10 years ago, will now be refunded based on this case, but still there is movement here, something to just be aware of. And then the next item is also related to the Affordable Care Act, but more specifically the preventive care mandate. So the Supreme Court issued their ruling in Kennedy v. Braidwood, and they upheld the Affordable Care Act's preventive care mandate. And specifically, they held that the U.S. Preventive Service Task Force has the authority to determine which services will be available free of cost to Americans covered by the ACA, which also includes employer-specific health plans. So this case arose due to a lawsuit that sought to undo the preventive care provision by challenging the appointment process for members of a 16-person task force that determines which preventive services are to be provided for free under insurance policies. So this rule is saying that it's okay for them to continue doing this. The reason it's significant is that in order to get to the Supreme Court, just a bit of background, there are multiple cases that need to happen. There's multiple steps that need to happen. They have to be appealed. So the lower courts disagreed and said that they did not have this authority. And then the Supreme Court said, yes, they actually do. So something to just, it was notable. It happened within the last few weeks. So no real changes need to occur for your plan at this time. And then next item is related to state laws regulating PBMs. So a number of states are enacting legislation to regulate pharmacy benefit managers in an effort to curb drug prices and promote PBM accountability. Pending bills in this space include efforts to prohibit spread pricing, requirements for PBMs to report on rebates it receives, and requirements related to registration with the state in which it operates. One regulation that created a bit of a stir came out of Arkansas and prohibits PBMs from acquiring or holding a direct or indirect interest in a pharmacy. So this is a big law. As I'm sure you know, a lot of PBMs are also owners of a pharmacy. That's how they do a lot of their business. So following the signature of this law in April, CVS stated that it would be closing its Arkansas locations as a result of the law, basically saying we're not going to divest from our pharmacies or from our PBM, so we're just going to close any CVS pharmacies within the state. Subsequently, CVS Health and Cigna, and then also a Pharmaceutical Care Management Association, have each filed suits in Arkansas arguing that the law is unconstitutional. It remains to be seen what will ultimately come of the state's legislation, but the various bills are indication that PBM reform is a top priority at the state and federal level. So again, like I've said, more to come here. We are currently tracking a number of states who are pushing bills forward related to PBM accountability. Arkansas was the first state to have something like this, where they're saying that the PBM cannot own a pharmacy. We'll see if other states follow suit here, but definitely we are going to continue to see laws related to PBMs. The next item here are just a few pending state laws that we are currently tracking. The first is coming out of New Jersey, and it would require third-party discounts and payments for individuals covered by health benefit plans to apply to co-payments, co-insurance deductibles, or other out-of-pocket costs for covered benefits. This bill was introduced June 30th, 2025, so no real indication of where it's going to go at this time, but still something interesting wanted to mention. As you know, I'm sure just because a bill is introduced today doesn't necessarily mean that it's going to be addressed anytime soon. The second item is also out of New Jersey, and it would prohibit health insurance carriers from using human body weight as a factor in determining coverage for treatment of eating disorders. This passed the first chamber in May, and then what that means is it just moves to the next level of review to determine whether or not it's going to be vetoed or sent back to the previous chamber. Then we have a bill coming out of Maryland, and this would require certain carriers, PBMs, and private review agents to ensure that artificial intelligence algorithms and other software tools are used in a certain manner when used for conducting utilization reviews. So this was actually enacted in May. So this is something that's current in Maryland. Not necessarily anything that the plan sponsor needs to do, but it is just something to think about, especially as you are, acting as a fiduciary and reviewing your plans and reviewing your costs. Just something to keep in mind that there are regulations that say, and likely more to come, that say that artificial intelligence, if being used, needs to be used in a specific manner. And then finally, we have a bill coming out of New York, which would require insurance coverage for early egg and peanut allergen introduction dietary supplements for infants at no cost. This was introduced in May. we'll see what ends up happening with this and the others, but just always interesting, at least I find it interesting to see what bills are pending in the various states. And it really does help us see what states are really thinking about, what legal laws, bills, all of that are being pushed forward. We see that in a number of states, things are very similar. So it really does kind of evidence that the government is paying attention to health and welfare benefits. With that, I will move on to some things that are on the horizon. So the first item here is related to the PCORI fee. So this fee is due at the end of July. It's nothing new. It was expected to sunset a few years ago, and then they extended it till 2029. So it is here to stay for now, but did just want to talk about it kind of quickly since the due date is coming up within the next few weeks. So the fee is applicable to fully insured, self-funded, level-funded plans and HRAs. So for plan years ending on or after October 1st, 2023, and before October 1st, 2024, the fee amount is $3.22 per covered life. For plan years ending on or after October 1st, 24, and before October 1st, 25, the fee is $3.47 per covered life. So once the calculation is completed, the plan sponsor should complete Form 720 and then remit that payment to the IRS. So the fee per covered life, the dollar amount isn't huge, which is good. I mean, obviously, the more folks you have on the plan, the higher the fee. Something to note is that on the fully insured, self-funded, level-funded side, the fee is assessed based on the individuals that are covered, or belly buttons, so to speak. And then on the HRA side, it's just the members, the employee participants. So before moving to the next topic, did want to touch on something. I have been getting some questions around this, so figured it would be nice to discuss with the group. If the employer has a self-funded health plan or a level-funded health plan and an HRA, and the plans have the same plan year, then the employer is only obligated to pay one PCORI fee. And the view here is that folks that have the HRA are likely covered by the health plan. So therefore, you don't necessarily need to double dip, so to speak. The second item here, which I think is really the big caveat, is that if you have those plans, but they have different plan years, then the fee is assessed for the health plan, the self-funded or level-funded health plan, as well as the HRA. So you have to pay two different fees. Just something to keep in mind. For the most part, folks usually have their HRA and their health plans having the same plan year. So it's not necessarily something that has come up, but still want to keep that in mind. The final reminder here is just related to the actual quarter that should be included when you complete the form. The date should be the last day of Q2 or June 30th of the year in which the fee is being paid, not the last day of the plan year. So something that has come up, so I figured I would bring it up with you guys as well. With that, I will move into Form 5500s, something that folks are aware. Form 5500s are due annually as of the last day of the 7th month following the end of the plan year. So for 1/1 plan years, that due date is July 31st, so coming up within the next few weeks. If an extension is needed to file the Form 5500, folks can file the Form 5558, and that grants an additional 2.5 months to file. That extension is automatic as soon as it's filed, so it isn't necessarily something that you have to wait on. If you just file the document, you can pretty much operate on the assumption that you're good to go and that your extension was accepted. One of the things I did want to note here, because I have also received questions around this, is related to the WRAP plan document as it relates to the Form 5500. So the WRAP plan allows, among other things, it allows a plan sponsor who has to file the 5500 to only file one 5500 and include all of the corresponding Schedule A's within that one document. If you want to do that, you have to have a wrap plan in place. If you do not have a wrap plan in place and you have been filing 15500, that's an issue. One of the things that I do want to note is that if you have a wrap plan in place, you need to include all of the plans that would be subject to the 5500 requirement in your 5500, regardless of number of plan participants. So something to think about, if you have 100 participants on your life plan, but only 90 on your dental plan, for example, and you have a wrap plan, that dental plan still needs to be included in that 5500. So just because it has under 100 participants, under that 100 participant threshold, that does not necessarily matter. You still need to include that plan. So the wrap is great if you have to file multiple 5500s anyway, but still something to think about if you have less than 100 participants. I still typically suggest that everybody has a wrap plan in place. It just streamlines a number of other plan document distribution requirements, but something to think about. We have noticed that it's not uncommon for a wrap plan to not exist, and the employer is still filing 15500. So really something to keep in mind. So with that, I'll move into Medicare Part D. So the Inflation Reduction Act of 2022 created some changes for determining whether your prescription drug plan is creditable or non-creditable. So as a reminder, plan sponsors are required to send their plan participants and beneficiaries the notice of creditable or non-creditable coverage annually by October 15th. And the reason for that date is that starts the open enrollment period for Medicare. So if the plan ends up being non-creditable, then the individual who is eligible for Medicare would need to enroll in a creditable prescription drug plan in order to not be subject to some kind of penalty. So previously, plan sponsors were able to utilize the simplified determination method or the actuarial method to make the determination of whether the plan was creditable. However, under the Inflation Reduction Act, the simplified method sunset in 2025. Then, in April, CMS finalized new rules related to the creditable coverage determination, in which they noted that the simplified determination method is still acceptable to use, and it would be releasing a revised calculation to align with the Inflation Reduction Act. The new guidelines require that the group health plan covers at least 72% of prescription drug costs to qualify as creditable, which is an increase from the 60% that we were initially used to. So we're still waiting on what the calculation, what this new method will look like, but it is definitely a welcome statement. It's welcome news. Otherwise, a lot of plan sponsors would need to engage with an actuary, and that's not necessarily something that they easily have access to. So, this is welcome. We are still waiting for what the simplified determination method will actually look like, but still good news. And then the other thing here, I'm not going to spend too much time on this. Really just want to note that really all of the civil monetary penalties for 2025, there was an increase. So for failure to file a 5500, that increased to $2,739 per day. So really, that's a big one. Something to think about. If you realize that you're getting close to whatever due date you have for your 5500, just file that extension. It gives you some more wiggle room. Even if you do end up being able to get the 5500 filed before the due date, it's just better to have that extension filed. Better safe than sorry. I will note that in the event that you don't file your 5500 timely, the DOL has a voluntary delinquent filer program that would allow you to pay a reduced penalty if you file through that program. Basically, for lack of better terms, you're kind of telling on yourself, and you can file through that program. Some of the other notes here, failure to furnish information requested by the DOL, that penalty is up to $195 per day. Failure to inform employees of their CHIP coverage opportunities, that penalty is up to $145 per day. So that CHIP notice is something that needs to go out. As a reminder, there are a number of annual notices. Typically, we see those notices going out with open enrollment documents. They should also, if you have an intranet site, you can post them there as well. Next is failure to provide the summary of benefit and coverage. So the SBCs, that penalty is up to $1,443 per failure. And then finally, a failure by group health plans or plan sponsors to meet requirements of ERISA regarding genetic health information. So that's that GINA Act. I'm sure you may be familiar with that. And that is $145 per day. So as you can see, there are slight increases across the board on some of these things. Distribution of plan documents is important, and also being able to provide the plan document if it's requested. So as you can see here, just a few high level employer responsibilities. So like I said, summary plan descriptions, that's your wrap document, that's any kind of component plan documents, your SBCs, annual notices, as you can see here. There are requirements to make sure those documents are being appropriately distributed, and in the event that they're requested either by the employee or a government entity, you need to be able to provide those documents in a timely fashion. I didn't spend too much time on this because I have discussed it previously, but we are seeing fiduciary lawsuits. And one of the things that typically ends up coming up is that the plan sponsor failed to distribute the plan documents in a timely fashion. And that's a violation of your fiduciary duty. So as you're starting to think about your meeting minutes and your charter for your fiduciary committee, you want to make sure that you are distributing these documents in the appropriate way, either electronically, if that's an option for you, or non-electronically, if your employees do not have work-related access to computers. Next item, non-discrimination testing. So I talked a little bit about this when we were discussing the DCFSA limit increase, but just a reminder, non-discrimination testing is an annual requirement, and there are non-discrimination testing obligations for your cafeteria plan, for your self-funded health plan, which also includes healthcare FSAs and HRAs, for your group term life plan, for your dependent care assistance plan, education assistance plan, adoption assistance plan. So there are a number of obligations here related to NDT. So if you aren't already conducting this testing, or maybe it's been a few years since you've conducted it, you really want to think about getting this testing done, just so you know where you're at. And then in the event of a failure, you're able to implement those corrections proactively, and you can avoid, you're mitigating the risk, so to speak, at that point, because there is no guarantee that if for some reason some kind of fiduciary lawsuit comes up, they may ask for the results of these NDTs. So you really want to make sure that everything is ready to go. And then the final item is the HIPAA privacy and security obligations. I talked a little bit about some of the changes related to the notice and privacy practices. Want to make sure that your notices are up to date. If you have any BAAs in place, want to make sure that those are up to date and still good. Make sure that your HIPAA privacy policies and security policies are good, as well as making sure that if you are subject to requirements related to training, that you are conducting those trainings on an annual basis. And now I will touch on the Secure Act. So just quickly, some background. The Secure Act was passed in 2022, and it built on previously enacted Secure Act of 2019. So recognizing that there is this ever-present retirement crisis, so to speak, meaning that folks are just not retiring on time, or they're not saving enough to be able to retire, the Secure Act, in an effort to combat this, has a number of provisions that are trying to promote folks' ability to save for retirement. The 2.0 changes directly impacts on Roth accounts, IRAs, 401ks, and 403bs, and then it also provides a number of tax breaks. So the main item that I really wanted to talk about is the student loan match option. So this was effective for plan years starting after 12/31/2023. And what it did is allowed employers to treat an employee's qualifying student loan repayment as elective deferrals or after-tax contributions for the purpose of the plan's matching contribution to a 401k or a 403b plan. This was an optional change. If you wanted to implement it, you would need to just update the plan document. So why am I even mentioning this? Because it was effective in 2023. So the big beautiful bill made changes as it relates to student loans. So specifically, it created a cap to how much an individual is able to borrow, which will likely to lead to an individual seeking private student loans with higher interest rates if they wish to pursue graduate or professional school. It also eliminated existing income-driven repayment plans and replaced them with different options. So in light of these changes, it's entirely possible that less funds are going to be allocated towards a retirement account. So to combat this, a plan sponsor may want to consider implementing the student loan match into their plan to allow for the employee to still save for retirement. So just something to think about. If you do have any questions on this, please let me know. Let our retirement practice know. But really something to think about. As you talk about and you consider ways to boost employee retention or to boost folks contributing to the retirement plan, this is something that could be implemented and could be really beneficial, especially since we are seeing these changes to student loan repayment. And then the next item here, just wanted to highlight is that the first one is related to the catch-up limit increase. So this is not effective until the end of 2025. So effective 1/1/26, individuals meeting the salary threshold who are eligible for catch-up contributions will need to make them to a Roth account on an after-tax basis. So while the participant will lose the upfront tax break associated with pre-tax contributions, the Roth funds can be withdrawn tax-free in retirement. This was initially supposed to be effective 1/1/24. But recognizing the administrative burden that this would place on plan sponsors, the IRS delayed it until 2026. So now that we're in July, it is starting to come up pretty quickly. So something to be thinking about. And then the other item here is just related to Roth catch-up contributions. This is also effective 1/1/26. And this is for a catch-up limit for folks aged 60 to 63 will be the greater of $10,000 or 50% more than the regular catch-up contribution for the year. And again, these changes are optional, so will ultimately be up to the plan sponsor whether they want to implement the changes. Um, as with almost every change to the plan, there needs to be an update to the plan document according to what change you did, and include all of the other aspects of the change, really just driving home the importance of your fiduciary obligations, making sure that you are adhering to those responsibilities. Right. And then with that, there are just some next steps. As always, you want to continue to monitor for updates and discuss with your vendors and TPAs how potential changes may impact your plans. We talked a lot about this push for transparency, this fiduciary obligation. So really making sure that you are good to go, so to speak, that you're establishing that committee, you are adhering to those responsibilities. Um, and then, just if you have any additional questions, please feel free to reach out. We're always available, to discuss further if you do have any questions. But you wanted to just note a few things. I know there was a lot. If you do have any questions, please let me know. But with that, I will stop the presentation. Thank you for listening. And do we have any questions? Looking in the chat. Trying to think. Don't see anything yet. I'll give another minute or so. See if we get any questions. But if not, thank you so much for joining. Like I said, I know it was a lot of information, but it is definitely important things to keep in mind. We are continuing to see regulatory changes, especially now that we're in a new administration. As we see with every changeover with administrations, different administrations focus on different things. So it really is just crucial to be mindful of the changes and be mindful of how any of those changes may impact your plans. Okay. With that, I will end the event. Thank you so much for joining. And of course, as always, if you do have any other questions, please feel free to reach directly out to us. We're always happy to assist. We have a number of presentations coming out throughout the year. So, make sure you're on our social media or checking our website. Our marketing director does a great job of making sure all of those things are posted. But if you do end up having any questions, please feel free to reach out. And thank you so much for joining.